Namaste. Welcome to today's session. In the previous module, we have discussed stress-related eye problems, errors of refraction, and evidence-based yogic management of these problems. In this module, we will be discussing few more eye problems and yogic solution from research perspectives. In this module, we will focus on eye problems like glaucoma, cataract, age-related macular degeneration, and evidence-based yogic solution for each of these eye problems. Coming to what is this condition glaucoma? Most of you must have heard. People say he has glaucoma, people are putting drops for it. But let us today understand the pathology of what is glaucoma. Glaucoma is a group of eye conditions that damage the optic nerve. The optic nerve sends visual information from the eye to the brain and is vital for good vision. Damage to the optic nerve is often related to high pressure in the eye, otherwise known as increased intraocular pressure. But glaucoma can happen even with normal eye pressure. Glaucoma can occur at any age, but is more common in older adults. It is one of the leading causes of blindness for people over the age of 60. Many forms of glaucoma have no warning signs. The effect is so gradual that you may not notice a change in vision until the condition is in its later stages. Glaucoma develops when the optic nerve becomes damaged. As this nerve gradually deteriorates, blind spots develop in the vision. For reasons that doctors don't fully understand, this nerve damage is usually related to increased pressure in the eye. What are the other causes? Elevated eye pressure happens as the result of a buildup of fluid that flows through the inside of the eye. This fluid also is known as aqueous humor. It usually drains through a tissue located at the angle where the iris and cornea meet. This tissue also is called the trabecular meshwork. The cornea is important to vision because it lets light into the eye. When the eye makes too much fluid or the drainage system doesn't work properly, eye pressure may increase. There are many types of glaucoma. There are mainly two kinds of glaucoma, one being open angle glaucoma. This is the most common form of glaucoma. The drainage angle formed by the iris and cornea remain open, but other parts of the drainage system don't drain properly. This may lead to a slow, gradual increase in eye pressure. Closed angle glaucoma, or otherwise known as angle closure glaucoma. This form of glaucoma occurs when the iris bulges. The bulging iris partially or completely blocks the drainage angle. As a result, fluid cannot circulate through the eye and pressure increases. Angle closure glaucoma may occur suddenly or gradually. What are the other types of glaucoma? One is called normal tension glaucoma. That is, the optic nerve may be sensitive or experience less blood flow. This limited blood flow may be caused by the buildup of fatty deposits in the arteries or other conditions like atherosclerosis. Congenital glaucoma. A child may be born with glaucoma or develop it in the first few years of life. Blocked drainage, injury, or an underlying medical condition may cause optic nerve damage. Pigmentary glaucoma. With this form, tiny bits of pigment from your iris, the colored part of your eye, get into the fluid inside the eye and clog the drainage canals. Now coming to what are the symptoms. Symptoms of open angle glaucoma are no symptoms in early stages, gradually patchy blind spots in the side vision, Side vision also is known as peripheral vision. In later stages, difficulty seeing things in the central vision. Acute angle closure glaucoma, severe headache, severe eye pain, nausea or vomiting, blurred vision, halos or colored rings around lights, eye redness. What are the other symptoms? Normal tension glaucoma, no symptoms in the early stages. Gradual blurred vision, later stages, loss of sight vision. Congenital glaucoma, a dull or cloudy eye in the infants, increased blinking in infants, tears in infants without crying, blurred vision, nearsightedness getting worse, and headache. Pigmentary glaucoma, they see a halo around the lights, blurred vision with exercise, gradual loss of side vision. What are the risk factors? High internal eye pressure, also known as intraocular pressure, age over 55 years, family history of glaucoma, certain medical conditions such as diabetes, migraine, high blood pressure, and sickle cell anemia, corneas that are thin in the center, extreme nearsightedness or farsightedness, eye injury or certain types of eye surgery, taking corticosteroid medicines, especially eye drops for a long time. Some people have narrow drainage angles, putting them at increased risk of angle closure glaucoma. What is the prevalence? It is the second most common cause of blindness worldwide. World Health Organization has estimated that 4.5 billion people are blind due to glaucoma. In India, it is the leading cause of irregular blindness, with at least 12 million people affected and nearly 1.2 million blind from this disease. More than 90% of cases of glaucoma remain undiagnosed in the community. Glaucoma prevalence increases with age. What are the functional implications of glaucoma? Initially, no functional implications because it is a silent disease. Difficulty adjusting to lighting changes between indoors and outdoors. Occasional blurred vision, seeing a halo around eyes, increased sensitivity to glare and light. Difficulty identifying the edge or steps or road, tripping over or bumping into objects. How do you prevent glaucoma? Regular eye examinations to ensure early detection and treatment are the only way to control glaucoma. Family history, if somebody has a family history, they have to be more careful and get themselves tested regularly. Wearing eye protection while using power tools or playing sports. What is the treatment of glaucoma? Treatments are available, but early detection is the key. Lost vision cannot be recovered. Treatment aims to prevent further vision loss. Treatment may involve medication, eye drops, laser or other surgery, as well as regular monitoring. Early glaucoma is often asymptomatic. Regular eye tests are important. Long-term compliance is a main concern because 1/3 of the people indicate poor adherence to drop therapy. Now coming to what is the evidence-based solution for glaucoma. Yoga has been found to reduce eye fatigue score and intraocular pressure. A few researchers have proposed the Trataka Kriya, which involves accommodation of eyes, will be useful in lowering of intraocular pressure in glaucoma patients by alternate contraction and relaxation of ciliary muscles, which might increase outflow of aqueous humor. In this I want to make a point. Many people, including yoga therapists, think glaucoma is not good for the eyes. They believe intense focusing could aggravate the intraocular pressure. Through research, we have seen that if you do Trataka, actually the intraocular pressure comes down because the muscles are contracting and there is lowering of intraocular pressure. Studies are conducted to evaluate the effect of Nadi Shuddhi on intraocular pressure. 19 subjects were included and they were compared with 28 subjects, and they showed that there was not much of change, but actually it could help in the holistic treatment of glaucoma. What to avoid? Isometric exercise. Different types of isometric exercises such as mid-thigh clean pull and squat exercises were given to assess the intraocular pressure during a 1-minute period of physical effort and the immediate 1 minute of recovery at 3 different intensities. There is a progressive and instantaneous increase in intraocular pressure during isometric exercise, which are positively associated with exercise intensity. After exercise, intraocular pressure rapidly returned to baseline levels. Now, avoid for glaucoma. All head down positions increase pressure in the eyes and they have to be avoided, like Adhomukha Svanasana, Uttanasana, Halasana, Vipritakarani. Jessica et al. Measured the intraocular pressure, fluid pressure inside the eyeball in 10 persons with no eye problems and 10 persons with eye pressure during and after the practice of 4 head down postures, that is Adhomukha Svanasana, Uttanasana, Halasana and Vipritakarani. She showed that head down positions produce a rapid rise in intraocular pressure in glaucoma and healthy eyes, which return to baseline values within 2 minutes. Hence, it is important to remember that patients with glaucoma should avoid all head down yoga postures. Are dynamic exercises safe? Swimming is safe, but with goggles increases pressure. Scuba diving and bungee jumping are not safe in patients with glaucoma. Isometric exercises also increase intraocular pressure. Dynamic exercise is effective in reducing intraocular pressure in healthy or persons with short sight or myopia, as well as patients with glaucoma. Physical exercise consistently improves ocular partial pressure. No changes in blood circulation due to autoregulation in healthy subjects. Exercise reduces anxiety, depression, and improves quality of life in glaucoma patients. However, although swimming with goggles is considered safe in the healthy population, it has a potential to elevate the intraocular pressure to damaging levels and result in disease progression in patients with glaucoma. Extreme exercises can be risky. Furthermore, performing isometric exercise, especially body inversion, requires special precautions. High intensity exercise involving breath holding or head down position could cause sudden increase in intraocular pressure and should be avoided in patients. Now, coming to the next topic of discussion in today's session, we are going to discuss cataract. You must have heard of this very commonly. You'll see he had a cataract surgery. Now, what is this cataract? A cataract is the clouding of the lens inside the eye. With the cataract, light is scattered as it enters the eye, causing blurred vision. What are the causes of cataract? Aging is the most common cause. This is due to normal eye changes that begin to happen after 40 years. That is, when normal proteins in the lens start to leak down. This is what causes the lens to get cloudy. People over age 60 usually start to have some clouding of their lenses. However, vision problems may not happen until years later. Other reasons for cataract include having parents, brothers, sisters or other family members who have cataracts, or certain medical problems like diabetes, smoking, having eye injury, eye surgery, radiation treatments, having spent a lot of time in the sun without sunglasses that protect the eye from damaging ultraviolet radiations, using certain medications such as corticosteroids which may cause early formation of cataracts. Most age-related cataracts develop gradually. Other cataracts can develop more quickly, such as those in younger people or those with diabetes. There is a rapid progression. What are the symptoms? Having blurry vision, seeing double or a ghosted image, having extra sensitivity to light, especially incoming headlights at night, having trouble seeing well at night, seeing bright colors as faded. Prevalence and risk factors: 31% of the population over the age of 55 has a cataract. Long-term use of corticosteroids can increase risk of cataracts. Exposure to ultraviolet radiation can also increase the risk. Aging, smoking, having diabetes can increase the risk of developing cataract. Functional implications of cataract: blurred vision, reduced contrast, having difficulty judging the depth, seeing a halo or double vision around lights at night, seeing images as if through a veil of smoke, being particularly sensitive to glare and light, having dulled color vision. Prevention: protect eyes from the sun, protect eyes from injury, quit smoking, make eye healthy food choices. Above steps can be adopted to protect eyes from cataracts. Treatment of cataract: using brighter lights at home or work, wearing anti-glare sunglasses, using magnifying lenses for reading and other activities. Updating glasses can help with early cataract. Surgery at a later stage. Yoga practices found to be effective at the initial stages of cataract. Various practices are Netra Sanchalana, palming, asanas, pranayama, kriyas, cleansing practices, Kapalabhati, Jalaneti, Trataka, Om Trataka, Jyoti Trataka, Jatru Trataka, relaxation techniques, Yoga Nidra, Shavasana, using meditation practices, advanced techniques, cyclic meditation based on the principle of stimulation followed by relaxation. Pranic energization technique is an advanced technique of yoga developed by S. Vyasa, deemed to be Yoga University, in which we use our prana shakti to energize our entire body. Each and every organ of our body can be revitalized in this process, which helps in strengthening the immunity. Mind sound resonance technique is one of the advanced yoga techniques for achieving the goal of positive health, willpower, concentration, good memory and deep relaxation. MSRT generates resonance throughout the body by the repetition of mental sounds. This helps in revitalizing the internal energy of the body. These techniques are found to be effective in cataract. What is age-related macular degeneration? We come to the next or the third disease we are discussing in this session. Age-related macular degeneration is an eye disease that can blur your central vision. It happens when aging causes damage to the macula, the part of the eye that controls sharp, straight ahead vision. The macula is part of the retina, the light-sensitive tissue at the back of the eye. Age-related macular degeneration is acquired degeneration of the retina. There are many types. One is called dry AMD. This is quite common. About 80% of people who have AMD have the dry form. Dry AMD is when parts of the macula get thinner with age and tiny clumps of protein called drusen grow. You slowly lose central vision. There is no way to treat dry AMD yet. Wet AMD. This form is less common but much more serious. Wet AMD is when new Abnormal blood vessels grow under the retina. These vessels may leak blood or other fluids, causing scarring of the macula. You lose vision faster with wet AMD than with dry AMD. Causes are: risk increases threefold in age, and 75 years age is considered to be the time when a person develops ARMD. Cigarette smoking is known to be a very, very important cause for ARMD. Current smokers are twice likely compared to non-smokers. Genetic susceptibility is also known to cause ARMD. Other risk factors are cardiovascular disease, hypertension, female gender, white race, Europeans more common, hypercholesterolemia, obesity, hyperopia, family history, those with light colored iris. Eating a healthy diet in saturated food, like found in foods like meat, butter and cheese. Overweight, smoking cigarettes over 50-year-old, having hypertension, have a family history of macular degeneration, having a heart disease is another risk factor. High cholesterol levels are also an important cause. Changes. What happens in macular degeneration or age-related macular degeneration or ARMD? Neovascular drusen deposits in the macula appear like druce, derived from German word for potato stone. Retinal pigment, epithelium abnormalities, neovascular derangement, retinal pigment loss or retinal pigment epithelium loss in advanced disease, hemorrhage, subretinal fibrosis. What is the prevalence? It is tripling with each decade over 40 years. Aging. It is present in 13% of people between the ages of 70 to 75 and is the leading cause of vision impairment in Australia. Smoking increases the risk of developing ARMD. Family history is also a risk factor. Genes have been identified and linked with ARMD. Functional implications: difficulty distinguishing people's faces, difficulty with close work, perceiving straight lines as distorted or curved, unable to differentiate between the footpath and the road, difficulty identifying the edge of steps if there is no color contrast, unable to determine traffic light changes, difficulty reading with blurred words and letters running together. Prevention. Early detection is crucial. In the wet form, vision loss may be arrested with early treatment by an ophthalmologist. Regular eye examinations are the key. Most important, stop smoking. Treatment: improved with new technology, treated with intravitreal injections. Lost vision cannot be recovered, so early detection is the key. Now coming to the integrated approach of yoga therapy, which helps in delaying and aging process. The integrated approach deals not only at physical level but also pranic, mental and emotional levels. By practicing this, we understand that eye is not an isolated organ in the whole system. Our body, mind are all one single unit, and when the mind is going through a very stressful period, the eye problem can be a major issue. Practices like Shavasana, deep relaxation technique, quick relaxation technique, not only provide deep relaxation to eyes, but provide deep relaxation at the mind-body complex. Stamina building practices such as palming, winking, blinking are found to be effective for eye problems. In Trataka, we develop voluntary mastery over the involuntary reflexes of the eye by persistent stimulation followed by deep relaxation. Advanced techniques provide relaxation at a much deeper level and help in eye cure. All these techniques will be discussed in detail in our coming modules. Today we have discussed 3 different eye problems: glaucoma, cataract and age-related macular degeneration, and yoga as a solution. In the coming classes, we'll be discussing few other problems of the eyes where yoga can help. Thank you so much. Namaste.